Is it bad to walk with your toes turned out? Or do your feet really need to point straight ahead when you're walking? If you look on the internet about out-toeing or duck feet walking, as it's sometimes called, you'll see headlines like duck feet walking, the most common and most dangerous walking problem, or why you need to stop duck feet walking. But is it really that bad? Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain when duck feet walking is bad, who might actually benefit from walking with their toes turned out, how to know the difference, and how to walk in a way that's best for your body. So first of all, what exactly is duck feet walking? Well, like the name sounds, it's walking with your feet turned out like that. And a lot of times that contributes to a flattening of your arch with your hips internally rotating. And that can cause a lot of stress on your ankles, on your plantar fascia, on your knees, or on your hips. So it's no wonder that people say that duck feet walking is so bad. But if you look around you and you're out in a crowd and look at thousands of people, you probably don't see one person that's built exactly like you. So there's no one exact precise way for walking that works for everybody. And so there are some people that are structurally more inclined to walk with their feet toed out. When you look at how your feet point when you're walking, you can't just look at the feet in an isolated environment because they're connected to your knees and your hips. And once you plant your foot on the floor, the whole lower body is connected. So you need to have all your other joints in line before your foot is planted. And some people are more naturally inclined to toe out. Some people have feet that point straight ahead, and some people have feet that point inwards. Now that starts up at the hip. Your hip joint is oriented so that the sockets face downward, outwards, and a little bit forwards. And then the ball of the hip, it comes upwards, inwards, but also a little bit forwards. And so you have a ball that's facing forwards and a neck of the femur that's also facing forwards. So what that means is that the angle of your hips or the angle of your femurs is just a little bit in front of a frontal plane. And so if your knees were lined up parallel to that, everybody would toe out about 15 degrees, which is how much that angle is. But in most people, there's a little bit of torsion that actually happens as you're developing, twisting within the bone where it starts to turn your knees back forward actually through the bone itself. And that means that's not a correctable thing once your bones have completely developed. Now, that neck shaft angle is typically about 8 to 15 degrees is the normal range. So if you're going 15 degrees this way with your hips, and then you have torsion through the femur that brings you back another 15 degrees, your feet are going to point straight ahead. If you go more than 15 degrees through that neck shaft angle, you're going to end up pointing inwards, known as femoral anteversion. And if you go less than that 15 degrees, and 8 to 15 is normal, so really if you're more than 7 degrees turned out, that becomes what's known as femoral retroversion. So most people in that normal range are going to have their feet point straight forwards or up to 7 degrees pointing outwards. But some people are naturally inclined to point outwards more than that. And if you try to force your feet to point straight ahead when you're walking, what you're actually going to end up doing is internally rotating your hips, which can create problems, particularly in the tensor fascia lata, one of your hip flexors and abductor muscles, which causes a lot of problems, the most common which being IT band syndrome on the outside of your hip or on the outside of your knee. So what do you do if you do have femurs that naturally point outwards? Well, I happen to have that. I have almost a 0 degree inversion angle, which means my feet naturally turn out about 15 degrees. And when you're going through physical therapy school, they teach you what's normal for normals, but they don't necessarily teach you what's normal for abnormals or how to help people who have genetic abnormalities that can't necessarily be changed. And so through years of practice, both on myself as well as working with patients, I found a way to walk with the most optimal biomechanics, given that there's a genetic abnormality that you can't necessarily change. So first of all, how do you know if you are inverted, normal, or retroverted? And the easiest way to do that, there is a clinical test, but if you're just doing it on yourself, kind of go into full internal rotation, turn your thighs inwards as best you can, and then turn out as far as you can go. And then go to a mid-range position that feels pretty comfortable. It should be just kind of how your feet naturally fall. Now, if you look down from there and take a look at the direction that your feet are pointing, for most people, this is going to fall pretty close to how you're structurally built. Now, if your feet are flat, you do want to kind of dome your arches to lift the arch, and that will naturally turn your feet in because there's a joint in your feet that doesn't turn straight inwards and it doesn't turn straight sideways like that. It goes at kind of a 45-degree scooping angle. And so if you do toe out, that's going to naturally bring your feet a little bit more forwards. Now, if you are really toed out, it's probably not going to bring you all the way forwards. But whether or not you are toed out, kind of using that scooping action is helpful when you're walking because it helps dynamically support your arch using your muscles. And so activating the muscles on the inner side of your legs, which turn the feet inwards, and also your toe flexors. Those are known as the tibialis posterior, the flexor hallucis longus, meaning the big toe flexor, and the flexor digitorum longus, meaning the little toe flexors. And together those are called Tom, Dick, and Harry in anatomy classes because it's an easy acronym to remember. But the AN also stands for an artery and nerve, the tibial artery and nerve, which run around that inner bump of the ankle as well. And those can often get irritated when people walk duck-footed or overpronate like that, where their arch is flattening out. So regardless of whether you naturally toe out, toe in, or your toes point straight forward, activating your tibialis posterior and those toe flexors by kind of scooping the ground like that helps support your arch so that whether you're walking with your toes straight ahead or whether you're walking with your toes turned out slightly, that you're going to maintain your arch and not allow things to flatten, causing problems like plantar fasciitis, vertebral tunnel syndrome, knee problems, hip problems, and the like. So let's get on to how you can walk better if you are someone who's naturally retroverted or toed out. So in this case, because you need to go into a lot of inversion at your ankle to get your toes even close to pointing forwards, you are going to have to hit a little more on the outer side of your foot as you go to land than you might normally think you'd have to. And you'd think that would be a lot of pressure on the outer toes of your foot, but as long as you're not landing completely on the outside of your foot, it seems to be pretty okay, at least when I do it. So scoop the ground with your toes like that, and then you're going to hit slightly more on the outer side of the foot, again with your toes slightly turned out. If you force them forwards, again, you're going to be internally rotating at the hip, so just let the foot hit where it naturally does. Now you keep the arch domed and that arch scooped as you're walking through. And as you come to push off, you sort of roll over towards the big toe. And so the movement runs along the outside part of your foot, across the ball of your foot, and then you end up pushing off your big toe sort of to the side. So now you're stepping in the angle of where that other toe points. You're going to hit on the outside of that foot, keep the arch domed, and roll over to the big toe. And now you're walking in an angle that the other toe points. So you're always sort of progressing towards the toes with your body weight coming that way, and then that way, and that way. Which, with an arm swing that naturally swings with the opposite leg anyway, it actually works pretty well that you're just rotating your trunk and your body along with the direction that you're stepping. It's also very similar if you ever watch a long track speed skater, how they start out and they kind of push off the blade of their back skate, glide on the blade of their front skate, and then push off the blade of their back skate and glide on the blade of their front skate. That also activates your glutes, which are really important to walking properly. So again, here's how you do it. You would step forwards with your toes turned slightly out, hit on the outside part of your foot, keep the arch scooped or domed so your foot doesn't flatten out. Roll across the ball of the foot, push off the big toe, stepping in the direction that the other toes are pointing. Hit with on the outside of your foot, keep the arch domed, roll across the ball of your foot, and push off the big toe. So it's a skating type of motion. To see it from a front view, at least as far as the camera will allow, hit on the outside, push off, go to the opposite, like that. To see that in real time, just so it doesn't look so awkward. So there it is. So hopefully that calms your concerns if you do walk toed out. There are some things you want to keep in mind about not letting your feet flatten down, because that can create some pretty bad problems, whether it's foot problems, ankle problems, knee problems, or hip problems. But you don't need to worry about forcing your feet to point straight ahead. And in fact, you probably shouldn't, because that can cause problems elsewhere. So hopefully you did find this video helpful. If you did, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.